Good day everyone and welcome to Blackboard Pharmacology. So today we're going to discuss hormones. Now this is a very popular topic because a lot of our patients are using these kinds of drugs. Now I'm going to touch quickly on the estrogen and progesterone side effects and how they work and where they come from. And then we're just going to discuss some drugs that also have an influence on your hormones. This is mostly sex hormones, alright. And then I'm going to quickly talk about what to do when you missed a dosage of the contraceptive pill and what cautions that you have to remember when you give patients therapy, maybe in conjunction with the contraceptives. Thing that you need to warn them and that you have to remember, that is very important. Alright guys, let's start with estrogen. Now estrogen is in your body when you are born as a little baby girl, and then when you get older and you reach puberty, we will see an increase in your estrogen concentrations, and that will mean that you will have a period. Okay, so estrogen is always there, but it does change in concentration. It spikes and then it goes down again, and that is why we call it a period, because it happens in a cyclical manner. All right, now estrogen is secreted by your ovaries as well as your corpus luteum, and so you're first gonna have a trigger by the hormone LH and FSH, and then it's gonna move to an increase in estrogen as well as later on in your cycle progesterone. Alright, when you're born, estrogen is low. You reach puberty, estrogen concentrations increases, and then when you reach menopause, you're gonna see a decrease in your estrogen concentration as well. This will lead to vasomotoric symptoms and also osteoporosis. So that's going to be important because we want to treat conditions like that with the drugs we use when a lady or a woman doesn't have sufficient estrogen levels anymore. Alright, now progesterone is more secreted during the second half of your menstrual cycle, and this is secreted by the corpus luteum. Okay, now progesterone is going to be used in situations where we have an ovulation or we have heavy menstrual bleeding, things like that. It's not common that you use a progesterone as its own or on its own. We are rather going to use a contraceptive that's a combination of estrogen and progesterone. Okay, now progesterone has some side effects, which includes bloatingness, moodiness, acne, all that PMS symptoms, and even depression. Progesterone can even lead to depression, but it's only for a short period of time in your cycle you're going to experience these symptoms. But it's important to know, because now you will remember progesterone drugs will have the same side effects, right? Now let's quickly discuss hormonal replacement therapy. Hormonal replacement therapy is going to be used when a lady had an hysterectomy, either partially or fully. And if it's a partial hysterectomy, she's going to supplement with estrogen and progesterone. Okay, if it's a full hysterectomy, she can only supplement with estrogen. Since there's no ovaries left, the body can't secrete estrogen anymore, we need to give it in another form, right? Hormonal replacement therapy is usually there to treat vasomotoric symptoms as well as osteoporosis. But it's important to know that this is not your first line treatment for osteoporosis, because as soon as you stop taking the estrogen, you are going to experience the same osteoporosis or level of bone loss that you experienced before you started using the tablets. Alright. Now these contraceptives or hormonal replacement therapy comes in a lot of different forms. You can have patches, you can have a vaginal ring, as I said, a pessary, you can even get a 3-monthly injection. You can have the Mirena, which is an intrauterine device, which will give you contraception or protection against pregnancy for at least 5 years. And then obviously tablets, and then so there are a lot of different dosage forms to choose from. You choose which one works best for you, because obviously you're going to use this for a long period of time and we need our patients to adhere to this. Okay, just important things to remember with the patches. You're going to rotate your patch site. You're not going to put it every week or month, depending on how often you change it, on the same area. And you're not going to ever put it on the breast. Okay, so you can choose between the thighs, the stomach, the buttocks, any fatty area will do. And then for things like the Vagifem and the foamy, like the Femigel, those things when they start a patient on a therapy like that, they're gonna say, for example, you use once daily for the first 2 weeks or for the first week, and thereafter you use twice weekly. Okay, and then when they apply that medication to the vaginal area, they're going to have to abstain from intercourse for at least 2 or 3 hours. Okay, so just important things that you can mention to your patient to help the medication be more effective and to decrease discomfort.